Michael Azrak, welcome. So overnight Pfizer announced some promising results regarding the Pfizer vaccine against the new Omicron variant. Are there any early promising signs with the Moderna booster as well?
So very similar to Pfizer, we're conducting similar type studies. We hope to get some data out, I'd say within the next 7 to 10 days. So I was in actually Boston last week with our R&D scientists who've been working around the clock, looking at Omicron, looking at its efficacy, looking at the efficacy of the current Moderna vaccine. So we're hopeful to get some data as well in the next sort of week or so.
The WHO is also talking optimistically overnight about the strength of the vaccines against this Omicron variant and the possibility that the existing vaccines might be effective and we wouldn't necessarily need a boost, like an Omicron-specific booster shot. Is it looking like that could be the case or not?
I think the data's emerging. So
yeah.
It's encouraging what we're seeing overnight. I think with all strains and variants we've seen, it does take a few weeks to really assess it. So the data's, it's optimistic. I'd be cautious right now. And what we are doing as Moderna are looking at all fronts. So we've got a three-pronged strategy. One is looking at our current vaccine and the boosters at 2 different dose levels. We've got multivariant specific doses in development and an Omicron specific dose in development. So it's a sort of 3-layered strategy. The best thing we can all do right now is get our antibodies back up to where they were just after the primary series, which is what the boosters will do.
Either way, are you pretty confident that the vaccines will be able to take care of this Omicron variant?
I'm hopeful, but I need to be guided by the data, and we'll just have to wait and see how the data plays out.
Okay, now yesterday the TGA here in Australia announced approval for the Moderna booster shot. What will that mean for supply into Australia and demand here?
So it was a very good outcome for Australia. We now have 2 boosters available. So the Moderna booster, we're waiting on one next very critical step, and ATAGI has to provide the recommendation. Once that comes through, anyone over the age of 18 can get a Moderna booster 6 months after their second dose, regardless of the type of vaccine you had. So if you had Pfizer, AstraZeneca or Moderna, you could also get the Moderna dose as a booster. In terms of supply, the Department of Health has done an outstanding job to ensure supply is here, and there'll be no issues with supply. We're ready to go the moment we get that ATAGI approval.
So presumably over the coming months there'll be a lot of people who've taken the AstraZeneca injections and they'll be tossing up whether to get Moderna or Pfizer as a booster. What can you tell us about the studies that have been done so far about any possible reactions from taking a Moderna booster after you've had AstraZeneca injections?
The data that we've seen today, there hasn't been a considerable amount because the boosting has just started, especially in other countries, but we haven't seen any increase in sort of adverse events relative to what we saw with the initial primary series.
And people will be tossing up whether to have a Moderna or a Pfizer booster. Presumably you're going to be encouraging people to go Moderna, but is there any real difference between the two?
I'd always encourage people to speak to your healthcare professional. I think the data on both vaccines is very encouraging, and both vaccines confer very, very good efficacy. Talk to your healthcare professional if you're tossing up.
And with more people going down the Moderna path over the coming months, with Moderna now being approved as a booster, what can you tell us about what's happened with the Moderna rollout so far in Australia in terms of percentage of reactions, severe reactions, and in very rare cases, deaths?
Yeah, so we've had just over 1.2 million doses of Moderna administered in Australia. I don't have the exact percentages on the different types of adverse events. Needless to say, what I can say is they've been very rare, very much in line with what we've seen in overseas markets. So we're very confident that the efficacy and the safety profile that we saw in the clinical trial programs is playing out in the real world, especially here in Australia.
And so there'll no doubt be a lot of discussion around this, but so can you be any more specific than saying very rare?
Yeah, I can just say it's basically in line with what we've seen in the clinical trial program.
Right. Now, Moderna's been keen to, or is in talks with the federal government about possibly setting up a manufacturing facility here in Australia. Where are those discussions at, and can you give us an insight into those discussions?
Look, we've been in discussions with the Commonwealth for quite some time. They're progressing in a positive direction. I can't say much more than that, more than to say that Moderna is very keen to be part of the ecosystem here. I think it's really important for Australia to have onshore manufacturing capabilities of an advanced platform like Moderna's, and the discussions are heading in a positive direction, and hopefully we can have some readout on that in a not too distant future.
Would you be optimistic that there might be the establishment of a Moderna facility here, the initial work on that by the end of the year, or is that too soon? Or
I'd say that'd be very ambitious, given Christmas is just around the corner.
I mean, the end of next year.
I'd be hopeful, depending on how our discussions close out, but that would certainly be achievable, definitely.
Okay. Now, looking globally, equity organisations have criticised some of the manufacturers, saying that very little of the vaccines have gone into low-income countries. They're saying Moderna, only 0.2% of what Moderna has produced has got into low-income countries. Do you contest that statistic, and what are you doing to address that? Because the world needs to approach this on a global level. The Omicron variant has made that very clear, and those vaccines have to get into those low-income areas if the globe's going to get on top of this.
There's a saying I have that I've heard: a virus anywhere is a virus everywhere, and we've seen that with Omicron. So I think it's contingent upon all of us, governments, corporations, to ensure we try and get as many people vaccinated as possible. Moderna's committed to that. We're ramping up our production globally, working very closely with COVAX, working very closely with Gavi, looking at manufacturing in Africa. And I think as production across all vaccine platforms ramps up, I'm very hopeful we're going to see a significant ramp up in the number of people getting vaccinated globally.
So do you concede that it's only 0.2% so far? Because it's extraordinarily low percentage.
We're ramping up our supply as quickly as possible to make sure we can play our part when it comes to rolling out vaccines to those that need them.